We're back on Live at 9. Now, here's Kanji.
You already know about this one. This morning, we are learning the difference between allergies and a sinus infection. The following portion of Live at 9 is sponsored by Mid-South Ear, Nose, and Throat. And joining us this discussion here, Dr. Ben Tansey. Whew, boy, everyone has felt it at some point here in this area. Dr. Tansey, a lot of people assume that allergies and sinus infections are the same thing. Can you just, what is the difference there?
Yeah, so mainly allergies are going to be something that you're experiencing on a more regular basis. Sinus infections are going to be much rather episodic. And so with allergy infections, more times than not, it's going to present with, or allergy issues, it's going to present more with runny noses, sneezes, watery eyes, difficulty breathing through the nose. When you start getting into more of the realm of infections, more times than not, they actually start out viral. It's not necessarily some high fever or anything like that. It's just nasal congestion, runny nose. So it actually presents very similarly to allergies. However, usually those are precursors to the more serious sinus infections, bacterial sinus infections, much worse in difficulty breathing through the nose, loss of smell, fevers, some nasty stuff draining out the nose rather than the clear things, and so forth. And so most of the allergies and viruses are actually going to be precursors to the much more significant sinus infections that require antibiotics.
Wow, and it's so hard because the symptoms are so close. When do we know that allergies have maybe become more than just seasonal sniffles? You know? Yeah,
so it's one of those things too that the whole goal is actually to prevent it from becoming something more.
Right.
And so
stop it as soon as possible.
That's right. And so it's really never too early. And there's actually some rather simple treatments that you can do that not only improve your quality of life on the more basic things, but also prevent the more serious things from coming down the road. It's more severe sinus infections that require more invasive treatment.
So at what moment do I say, hey, Dr. Tansey, can I come in? Like, when do we know that we
Sure, yeah. I mean, honestly, I see patients from all different spectrums, and it doesn't mean that if you are too late, then there's not an option. You really can't come in too early because there's some pretty simple treatments that you can do, even over-the-counter type medicines. More times than not, people don't treat them effectively because they don't know exactly how to be using those medicines. And so that's where we can provide some guidance.
All right, and the best way when it comes to, you know, just allergy-related sinus problems, how do we face that?
I say it's just like eczema. How do you treat eczema? You put some cream on the skin. Well, the nasal sprays are kind of the cream of the nose, and so it really dampens that inflammatory response. And so the nasal sprays are the mainstay of treatment for those things. But certainly there are some other options. There's some injections that you can do. I think a lot of people try and avoid these things because they don't want sinus surgery. But really, that's just for the recalcitrant cases. We try and avoid sinus surgery at all costs on these patients.
Oh boy, there's so much to weed through. If we need help, just to guide us through and to maybe get us in if we need, what's the best way to reach out? Yeah,
so I think they listed the number on the screen. Certainly, we've kind of moved into an age of if you need something, just call. Our group has started to open up appointments for something rather even in an urgent manner. So usually you can get in at least within a day or two with somebody in our clinic, and we're happy to see you.
Oh, wonderful. Thank you so much for goodness helping us weed through this because it's a thing. I've been taken out many a time.
Yep, it's been a rough season for sure.
Dr. Tansey, thanks.
Yeah, thanks for having me.
And the preceding portion of Live at 9 was sponsored by Mid-South Ear, Nose, and Throat.